Hi everyone, Dr. Hadid here in Beverly Hills, California, and I want to talk about some of the technology that we use when we perform surgery, and in particular, I want to talk about the use of ultrasound and why we use it in our practice and why I think it's important. So I use the ultrasound for a variety of cases, particularly when I do fat grafting. And why do I think it's important to use an ultrasound when performing fat grafting? Well, with the Brazilian butt lift, for example, it's crucial that when we re-inject the fat back into the buttocks, that we stay above the muscle. We do not want to inject the fat into the gluteal muscles because that can create a lot of complications, including some potentially fatal complications. So when I use the ultrasound, when I perform my Brazilian butt lifts, this device allows me to ensure with 100% certainty that I am above the muscle, that I am injecting the fat not just in the right area, but also with precision in the exact area that I need to inject the fat to give you the best results. However, I also use this ultrasound as part of our tri-depth liposculpting body contouring technique, particularly when I'm re-injecting the fat back into particular muscle groups. In particular, it's important when I'm re-injecting fat back into the abdominal muscles to further accentuate the six-pack to utilize the ultrasound to make sure that I'm avoiding major blood vessels within the abdominal muscles. And also to make sure that I'm in the precise plane within the muscle that I need to be to minimize the risk of complications. So utilizing this ultrasound is an indispensable tool in my practice. Your safety is of paramount importance, and that's why I think that this ultrasound is something that further accentuates patient safety, and we can perform the fat grafting and rib remodeling procedures with a higher degree of confidence to give you the best results.